Hello, this is Dr. Justina Agnieszka Chevalier. I would like to address the topic of COVID virus now. COVID virus right now is a problem that consists of solving epidemiologic problems of the area of the United States in which I reside right now. What does that mean? In medicine, there are two separate approaches that every physician learns in medical school. First approach is the epidemiologic approach. Methodology associated with epidemiologic approach deals with the problems of the area. Second approach is the clinical approach. That approach is to solve problems reported by each and every individual separately, regardless of age or group that individual can be classified under. Those two approaches are different, and indications to deal with COVID, which is a pandemic. What does that mean? It means it is a place in which the majority of the area is affected by reported by the appropriate organization to register active cases of disease, so-called incidents of morbidity. What does it mean? It means affected persons in numbers on a given area with proven by tests presence of the virus, and mortality, which means affected by the area rate of deaths, how many persons died of the virus. Incidence applies to diseases that are acute in nature. To be able to follow proper indications to control a large amount of deaths and large amount of sick persons and to reduce it to zero is called epidemiologic approach or problem solving based in evidence. What is evidence? Evidence is proof of given state that is realistic and is appropriate to the time. Pandemia means simply a large, pan is a whole area of many cases, many cases, as opposed to small, like a burst of cases confined to less cases and smaller amount of territory. Indications in the United States as to the COVID virus have certain corrections that people need to be mindful of. What many persons forget working in administration, as well as seeing exclusively patients from the standpoint of an individual, is that every single indication has to answer the question what the treatment is, what I can offer to cure, what I can offer to prevent infections, what I can offer to prevent deaths. Those are the questions to answer. If a given method does not answer or provide a solution, then that is money and invasion of privacy or a physical injury caused for no reason. Example of that is, for example, testing a person for virus in area where there are no reported cases and testing persons that have no symptomatology in absence of treatment. That is an example of waste of money and resource. Another example of inappropriate intervention is an intervention when there is no treatment. What does it mean? Apart from telling that person you should stay at home, which is called quarantine, if that person has mild symptomatology and I as a physician and no one else, always and no one else, cannot offer treatment to shorten suffering or to cure, there is no point performing testing. So always bear that in mind. going to a given test or given a clinic that offers those tests, what the purpose of that test is. If the purpose is simply to report the case, then that is bioethically incorrect. In presence of symptoms of COVID-19, a person, each and every individual, needs to know, I right now have excretions. For instance, I sneeze, I cough, etc. I'm not talking about myself so that it's clear. I am actually healthy. I'm talking as a physician about persons which I could be at some point in the future that are right now facing this kind of problems. Answer your question, do I have now higher possibility to infect others? And if you present such symptoms, then that warrants wearing the mask and warrants closing self in own space or home. Otherwise, being healthy, being asymptomatic, does not need to wear mask because it actually obstructs respiration and prevents normal air exchange, and is per se, if one does not ooze those viruses, unnecessary. Similar indications are appropriate in areas where there is a higher level of awareness, meaning if persons are capable of performing such introspection. Am I infective? Which means, do I have possible active disease? If the answer is yes, then yes, each time I come in contact with others, I can infect them, and therefore I am to wear mask. If the answer is negative, I do not have active disease, then that mask is unnecessary. Now, the same as isolation. Second thing that is called a clinical approach or approach of the individual. If every individual is informed about such in mass media like this, and as well by practitioners, providers of medical health, we can reduce multiplication of those viruses as a result of having poor air exchange, poorly ventilated spaces in houses, as well as reduce psychological distress caused by fear of death or fear of being sick or fear of doing harm to others. This is very important because stress does influence health and immune system. Second thing to remember, if everybody does that, there is no need to fear contact with others. Healthy person is not carrier of the virus because that virus, similar as fungal and other particles, viral particles and bacteria, is everywhere. Meaning every single person having healthy immune system is able to assimilate that virus the same as we assimilate in health, thanks to immune system, things that are precipitations, things that are commensal bacteria and viruses and fungus. And that is why there is no need for extra care or extra distancing if that virus is not active in self and persons are aware and educated. Different rules from the standpoint of epidemiology apply to persons who are in public places. Persons who are in public places and deal with especially large amount of highly probable to be sick from COVID-19, such as hospitals, hospices, shelters, also places that dispense basic needs. Those persons, despite being healthy, are always to wear protective mask. What does this mean? If I, as a customer, enter a shop and I am healthy, then I do not need to, from the standpoint of logic, to wear the mask. If the person who works there is healthy, that person has to wear that mask because that person provides attention also or principally to persons who are infected with COVID. For own protection, healthcare practitioners, social workers, practitioners of any sort of assistance to persons who are weakened by that virus or in state of immune system weakening, such as chronic diseases and administered for those medications, and those or post accidents as well, which is the same accident, is and this, and those persons are to wear the mask. If the person is in public space and has been infected, that person has to be tested. Has to be tested and removed from the work and put into quarantine. The person, on the other hand, who is a private person, who stays at home or works in different area where there is no customer service, that person's testing depends on severity of symptoms and available treatments. Many viruses offer antiviral treatment, prevention, as well in form of vaccines, which we do not yet have that is a standardized treatment, but can be intended. Then testing is warranted. If not, it is only a treatment to make sure that person can eat, drink, and be recovering using natural defenses.